Erin Kelly is representing Deputy Mayor Susan Miles Gustav. Sahira McNabb is representing Dr. Michelle Morse, all in a voting capacity. So next on the agenda is the adoption of the minutes for the Board of Directors meeting held on November 20th, 2025. Are there any questions or changes? Hearing none, can I hear a motion to accept the minutes? Please say yes.
Yes.
Opposed say no, so the motion carries. During the executive session, the board received and approved NYC Health and Hospitals medical staff credentialing initial appointments, reappointments, and changes of privileges for the month of December 2025. The board received and approved oral and written governing body reports from NYC Health and Hospitals Elmhurst and Bellevue. And the board also received and approved the written submission of the semi-annual governing body reports from NYC Health and Hospitals Metropolitan, Henry J. Carter Long-Term Acute Care Hospital, and Henry J. Carter Nursing Facility. So next is Vendex approval. Since we began the process of approving contracts prior to Vendex approvals, there are no items on today's agenda requiring Vendex approval. However, there are 17 items on previous board meetings pending Vendex approval. We will continue to notify the board as outstanding Vendex approvals are received. So I'm going to move on now to the resolution. So it's action item number 6, electing Valencia Lloyd to a second 5-year term beginning January 28, 2026, as a member of the Board of Directors of MetroPlus Health Plan, Inc., a public benefit corporation formed pursuant to Section 7385-20 of the Consolidated Laws of New York, to serve in such capacity for a 5-year term or until their successor has been duly elected and qualified or as otherwise provided in the MetroPlus bylaws. And this was presented to the Board of Directors today. It's being presented to the Board of Directors today.
Yes, this is a reappointment. Valencia Lloyd has been on our board since 2021. She's a former director of managed care at the New York State Department of Health, and she's had experience with Partners Health Plans. She has a wealth of experience, and she's been an absolutely terrific board member. She is involved, pays attention, has excellent judgment, and brings excellent insight. This is an appointment from the chair of the board. And we would be delighted to have her serve in an additional 5-year term.
Thank you. Any questions? Okay, let's take it up for the vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you.
Thank you very much.
Number 7, approving the New York City Health and Hospitals Corporation Annual Board Committee assignments effective January 1st, 2026, as set forth for the attachment hereto as mandated by Article 6, Section 1C of the bylaws. Further authorizing as set forth in Article 5, Section 1, the vice chair shall be chosen by the board from among themselves and shall be elected annually. Approving the New York City Health and Hospitals Corporation to appoint Frida Wang as the vice chair of the board of directors, and this is being presented to the board now. So you have all the documents in front of you, and any questions or comments? Okay, let me then take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you for your service, all these activities. Really appreciate it as always. So let me move to number 8, authorizing the New York City Health and Hospitals Corporation, the system, to create a wholly owned subsidiary public benefit corporation to be named H&H Maimonides, or such similar name as is acceptable to the New York State Secretary of State and the New York State Department of Health, which will own the assets of and serve as the co-established operator with the system of a hospital licensed under Article 28 of the New York Public Health Law, and further authorizing the system to create a wholly owned subsidiary public benefit corporation to be named H&H Midwood, or such a similar name as is acceptable to the New York State Secretary of State and the New York State Department of Health, which will own the assets of and serve as a co-established operator with the system of a hospital license under Article 28 of the New York Public Health Law. And this is being presented today to the Board of Directors.
Thanks so much, Jose. Andy Cohen, General Counsel, and I'm here with my colleague,
Joanna Wiener, Deputy Counsel.
And Joanna has been extremely essential in the legal team involved with this proposed Maimonides transaction, and that's what we're here to talk about today. So, yes, so just to bring you back to kind of where we are on the transaction, in November of this year, the board unanimously voted to allow H&H to enter into what we are calling an affiliation and asset transfer agreement with Maimonides, and to take appropriate actions to advance this contemplated transaction. To remind you, our anticipated close date for the transaction is March 31st, or before April 1st of 2026. We think it is appropriate to assume that that date will be March 31st, 2026, just to meet the April 1st date. As you may recall, when we came to you at the last board meeting to talk about the transaction, we said that there would be lots more activities and approvals requested of this board, and that one of them would likely be the creation of subsidiary public benefit corporations to hold the assets and liabilities, and that includes the actual physical structures of the Maimonides and Midwood hospitals. So we are here exactly today to do that, and we are doing that particularly rapidly because to make sure that we can secure all of the needed city, state, and other kind of approvals that will be needed for us to become the operator of those two hospitals by the close date. There's a lot of activities that have to be done, and we wanted to be able to get started kind of right away. So we are here today to ask you to authorize the creation of these subsidiaries so we can get that process started. And just to remind you and sort of ground you in your power as the board to create these subsidiaries, our enabling act, the act that created Health and Hospitals Corporation in the first place, allows the organization by a resolution of the board to create wholly owned subsidiaries that are automatically public benefit corporations, just like the Health and Hospitals Corporation is, and it can create subsidiaries to exercise and perform all or part of its purposes, powers, duties, functions, or activities, but there are a few limitations on what subsidiaries can do. They can't issue debt, hold debt, or create grandchildren subsidiaries, so to speak. And subsidiaries that are established for the purpose of operating a healthcare facility or delivering direct patient care also requires the approval of the mayor, in addition to whatever the state DOH and other regulators may require. So that's all comes directly from our statute. And Joanna is gonna walk you through this sort of simple proposed sort of structure to show you how the subsidiaries will work and take you into the details.
Okay, so the proposed structure you see in the diagram, NYC Health and Hospitals Corporation, that's us and all of our hospitals currently, all 10 acutes and other sites. We have a bunch of other subsidiaries, Metro Plus, for example, that lives in that box on the right in the other H&H subsidiaries box. And the new two hospitals, Midwood and Maimonides, will be each its own public benefit corporation subsidiary, and that's in that. Those are the two blue rectangles in the orange rectangle. We sort of separated those out just so you can see specifically these two hospitals are treated a little differently, only really by nature of their corporate separateness. And below that, there are the final two boxes. One you can see is called MMC Services, Inc. So that is basically the residual Maimonides. So Maimonides right now operates a hospital and employs a lot of people. It will no longer operate a hospital. That will, when transaction is closed, belong to H&H. But it will remain as a non-hospital operating not-for-profit corporation that continues to employ almost all of its personnel, not physicians, which I'll get to in a second. It's unionized personnel. The union contracts will remain in place, and with eventually some of the non-union staff, hopefully moving over to H&H employment, particularly the senior executive level, hospital level staff who are required to be employed by the hospital under New York regulation. The other box you see is the PC box. So that is going to be the employer of the Maimonides employed physicians. Maimonides employs all of its physicians, which is not the model that we use primarily here. As I'm sure you know, our physicians come from NYU and Mount Sinai and PAGNY and SUNY for the most part. Maimonides employs all of its physicians now. So once Maimonides no longer operates a hospital, under New York law, physicians cannot work for an organization that is not either physician-owned or that operates a healthcare facility. So MMC is no longer going to be operating a healthcare facility. We are creating a new professional corporation to employ those physicians. And those physicians, kind of like in the PAGNY model, are going to be providing clinical services to these facilities at Maimonides and Midwood. Structurally, so we talked about corporate separateness, but really they're going to look a lot like the model is structured. So they look a lot like our other hospitals. So you, the board, will be the board of those two subsidiary corporations. Unlike Metro Plus, which has its own board, this board will be the board of Maimonides and Midwood, H&H Maimonides, H&H Midwood. We call them a mirror board, but it just really means that you will have the same, the proposal is that you will have the same roles, including the same board officer roles that you have with respect to all of the H&H hospitals with Maimonides and Midwood. The corporate officers, that's the H&H employed corporate officers, the president, the secretary, general counsel, and SVPs will be the same for these two subsidiaries, these two hospital subsidiaries. For Article 28 purposes, like for approving credentials, for quality committees, this board will be that same board, just as you function as the board for Bellevue or Elmhurst or Harlem. You will be that board for H&H Maimonides and H&H Midwood. So H&H will be an active parent, which means that it is the co-established operator, that's what they call it. It allows H&H to have certain controls and reserved powers with respect to these hospitals, control the budget, control its policies and procedures. It needs to approve any filings of certificate of need, so for big changes at the hospitals themselves. We would approve, H&H board approves management and clinical services contracts and any changes to its bylaws and its initial bylaws as well. So that is it's a lot of overall structure, but happy to take questions.
So it says bylaws, we would have approval of bylaws or bylaw amendments. Do you anticipate that there would be a whole set of new bylaws and
Yeah.
amendments?
So we will be drafting bylaws that at the first time that the subsidiaries would actually meet, they would adopt those bylaws. We're drafting ones that mirror the health and hospitals bylaws to the greatest extent possible. There will be some differences because, for example, there are things that H&H does that the subsidiaries can't do, and so those things will be taken out of the bylaws, but they will otherwise mirror the H&H bylaws to a very large degree.
And we'll be approving them?
Yes, 100%.
So, I mean, I'm sure you would have done this anyway, but when we approve them, it might just be helpful to know what the changes are so we don't start debating things that.
Yep,
you already-
absolutely.
Yeah, of course, good idea.
Any other questions or comments? Hearing none, then let me take it up for the vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you. President's report, Dr. Katz.
Yes, thank you so much. The President's report, as always, is full of some of the amazing achievements and the amazing people who are in health and hospitals. I'm not going to, read the entire thing. I'll just hit some highlights, and you have it to read, and happy to hear any comments or answer any questions. 5 of our hospitals were named to U.S. News and World Report as the best hospitals for maternity care, including Elmhurst, Kings County, Lincoln, South Brooklyn Health, and Woodhall. We launched a major initiative to support patients with complex behavioral needs after they leave the hospital. This is something that, we are uniquely good at. New York City is a city full of great hospitals, but the bulk of inpatient psychiatric care happens at our hospitals. We want to make sure that when people leave, they have the resources they need to stay well. The QI committee has already met and welcomed Dr. Selwina Brewster as the Chief Medical Officer of South Brooklyn Health. We celebrated at North Central Bronx 10 years of simulation training, which has really completely changed how we educate doctors at every level. It's not just residents, it's attendings. In my generation, it was see one, do one, teach one, which was never a very good tradition because it meant practicing on patients. We no longer have to practice on patients because we have these phenomenally realistic mannequins that enable you to deliver babies that have that are at risk for hip distortion. You can practice inserting central lines. You can open the chest. They have one that's amazing. It's a little expensive, but well worth it. It's a whole simulated trauma where it sequentially starts to bleed in other places. And the surgeons, and it's not, the surgeons don't know what is next going to happen. But it's an amazing technology, and particularly good for complex things that are rare. That's why I mentioned the shoulder dystocia, because when the shoulder is in the wrong place, you can have a devastating outcome. But most deliveries are not going to be that. So it's not like you practice all the time how to deal with shoulder dystocia. It may happen to you, once every 5 to 10 years as an obstetrician that you're faced with that, depending on your volume. And so unless you practice the skill, chances are you're not going to be very good at it. And now, again, the mannequins are absolutely amazing. And people report that the experience is just like what the actual experience is. And I think something that this board has been very supportive of was our work with our sister agency, with Molly's great organization, on providing housing services to asylum seekers. Molly, we greatly appreciate that you've taken over all of the operations, where the close of the Row Hotel was the last one that we were operating. I think, say it again?
We're on track for the end of the year.
Very good. I think this was, heroic work on the part of both of our departments and the emergency management system, and a load of people throughout the city, that we made sure the children did not sleep on the streets, even if they arrived at our bus at 10 p.m. So with that, I need to read to you a series of our real estate transactions, so that they are available in the public record. So effective September 1, 2025, Health and Hospitals executed a multi-site license with Eye and Optics New York Inc. to provide retail optical services at 8 facilities for a term of 5 years, escalated 2.5% annually, and a total contract value for all 5 years of $986,297. Each facility has a distinct fair market value rate based on neighborhood comparables. The 5-year total for each facility is as follows: Bellevue, $214, Harlem, $38,897, Lincoln, $148,228, Metropolitan, $342,187, Queens 48,358, Kings 31,643, Woodhull 105,232, and Gouverneur 31,538. New York City Health and Hospitals added 3 new additional spaces to the existing license for Tasty Pick 6 Corp. For a total of 4 spaces at New York City Health and Hospitals Kings, commencing on August 1, 2025. The existing space is located in the D Building gift shop. The additional new spaces are located at the D Building restaurant space, the E Building a grab-and-go space, and the T Building restaurant space. And then effective August 15, 2025, New York City Health and Hospitals executed a new license with Healthy Choice Cafe Inc. at NYC Hospitals Carter to provide food services for a term of 5 years, escalated 3% annually, and a total contract value for all 5 years of $127,419. The cafe is on the first floor lobby of the LTAC. And with that, I'm happy to hear any of your thoughts or questions about the report.
Questions or comments? Thank you, Dr. Katz.
Thank you.
So the committee and subsidiary reports, the committee and subsidiary reports were emailed to you and are in your electronic folder for your review and submission into the record. Are there any questions or comments about the reports? Is there any old or new business from board members to come before this board? So hearing none, the board meeting is adjourned. Thank you.
Thank
Thank
you.
you.
This meeting is no longer being recorded.
This meeting is being transcribed and